The Western Cape Health Department is giving its vaccination drive a shot in the arm. The province administered more than 41,000 jabs this week and managed just over 34,500 in the previous week. The department's Chief Operating Officer, Dr. Saadiq Kariem, speaks to us now about this particular drive and the strides that it's making. No doubt some very impressive numbers that are coming through from the department in terms of getting people vaccinated. But I wonder, Dr. Kariem, could a little bit more be done?
No, absolutely. I think we found that with the festive season there was a slump and a drop in the number of people presenting at our vaccination sites. And we're obviously now starting to pick up the pace a little bit again as life returns back to normal. But you're quite right, I think more can be done. If we break down that numbers of people who have been vaccinated, we have about 54% of people in the Western Cape have received at least one dose, and around 47% of adults have received or are fully vaccinated. But if one breaks that down into categories, I think where more can be done are probably in the younger adult population. If we look at the 18 to 34-year-old group, for example, we find there that only 42% of those young adults have in fact been vaccinated. So there's still quite a bit of room to improve there, and particularly with the universities returning and the TVET colleges returning now back to normal, back to campuses. Our intention there is to work with our colleagues at the universities in order to improve the vaccination status of young adults.
Dr. Kariem, are you finding that vaccine hesitancy is still one of the big issues that dominate when it comes to people choosing not to get vaccinated? Or is it just a matter of what you just said, people coming back from the festive season and the numbers will naturally pick up? How much of a role is vaccine hesitancy still playing in this regard?
I think, unfortunately, it does play a significant role. I mean, particularly if one looks at this younger age group have access to social media. And there's quite a lot of misinformation that still exists out in social media. And people read all of this information, and it does put doubt in people's minds in terms of coming forward for vaccination. So unfortunately, I think it does play a significant role in people making that decision, and that's quite a pity, because I mean we know that vaccination saves lives. Our data from the Western Cape has proven that time and time again that vaccination in fact does reduce your risk of hospital admission for severe disease and also for death.
Now, absolutely. So would you say that your department has got a bigger role to play when it comes to messaging and getting the message out there around vaccinations and really just the fact that it does save lives?
Absolutely. I mean, we've conducted a study here by Professor Davies and a number of colleagues from both the faculties as well as from the Department of Health. I mean, we looked at about just under 17,000 people across the 4 waves, in fact, and found in that study that the risk that vaccination, compared to unvaccinated people, those who have been vaccinated had a 3 times lower risk of severe hospital admission, and in fact have a 4 times lower risk of death. So time and again, our data has proven that vaccination is effective at saving lives, and it's that message that we are putting out into the general media and getting people to understand the importance of vaccination, particularly also for the vulnerable groups like the elderly. We've had a campaign to increase the booster shots for the elderly, and encouraging to see that in the last 24 hours, we've had over 13,000 people being vaccinated in the last 24 hours. So I think our messaging is beginning to have an impact.
No, absolutely. It's starting to resonate with people. And as more and more people start to resonate with that messaging, your thoughts on the decision taken by government to extend the national state of a disaster. Do you think that we're moving in the right direction, or do you think that we need to start dealing with the pandemic a little bit differently?
My own thoughts on this, absolutely. I think that, with Omicron, and it's been shown, in particular in South Africa, because we obviously had identified the Omicron virus early on. I think we are beginning to move towards endemicity. And we need to start moving away from the sort of pandemic response and trying to deal with COVID as yet another illness that we are having to deal with. So I think the time is probably right for us to start moving towards, I would think, relaxing some of the disaster regulations and starting to move towards treating COVID as an endemic disease rather than as part of a global pandemic.
And then just as a final thought, Doc, booster shots coming into play at the moment, the importance of getting your booster shot as soon as you are able to. Just talk us through that.
Absolutely. I really want to encourage all those who are eligible for booster shots to please take up the opportunity right across South Africa. We really need you to come forward and to take those booster shots. So people who have had the Pfizer vaccine for 6 months after their second dose, and those who have had the Johnson & Johnson vaccine 2 months after that are eligible for the booster shot over 18 years. And I really want to encourage people to take up that offer. We found, for example, that in the elderly group, we have currently in the Western Cape 72% of people have received at least one dose. And we've administered just over 23,000 booster shots to people in that age group. And it really does save lives.
No, absolutely, Dr. Kariem, thank you very much for joining us.